strike is looming in the health sector following a 14-day ultimatum issued by the Kenya Union of Clinical Officers to government, citing delayed implementation of the return to work formula signed in September of last year.
Led by National Chairperson Peterson Wachira, the officers also accused the Social Health Authority, SHA, of discrimination.
They claim that clinical officers cannot practice under the new health insurance model. Why? Because of the failure of the Social Health Authority Board to recognize the health facilities registered by Clinical Officers Council.
Health facilities across the country are headed for paralysis if the Kenya Union of Clinical Officers make good their threat of downing tools on Sunday, January 19th, 2025.
Solidarity forever, solidarity forever.
Among the key provisions of the return to work deal that are unimplemented include the negotiation of a comprehensive collective bargaining agreement, promotions and job reclassifications, confirmation of universal health coverage staff into permanent and pensionable terms, comprehensive medical cover for all clinical officers, and conversion of all short-term contractual employment for clinical officers into permanent and pensionable terms.
The ministry and the county governments have not fully implemented the return to work agreement, given that the deadline for implementation was the first day of September 2024. We have done numerous letters, they have refused to respond. And that is why we are here today to call them to account. And by that declare that we are calling for a strike in the next 14 days. All the clinic officers under the 47 counties under the Ministry of Health shall proceed on strike as from the midnight of 19th January 2024.
The officials further alleged that the Social Health Authority Board has refused to recognize health facilities and practitioners registered under the Clinical Officers Council.
The Social Health Authority, with the help of the leadership of the ministry, is doing all it can be able to do to go against the tenets of the UHC. While the law provides that they are supposed to empanel and contract and allow clinic officers to pre-authorize, they have refused to do that. They have gone against the law.
This discrimination, therefore, hinders the practice of clinical officers and causes widespread suffering among Kenyans who are denied essential services provided by clinical officers. Many are forced to pay out of pocket for healthcare services, despite being registered member of the Social Health Authority.
Kenya Union of Clinical Officers Secretary General George Jibore also lamented that clinical officers are being coerced to license their facilities with the Kenya Medical Practitioners Dentist Council to benefit from the Social Health Authority.
The specialist clinical officers are being compelled to use the KMPDC, that the Kenya Medical Practitioner and Dentist Council license number from the medical officers for pre-authorization and practice that is both illegal and extortionate. We regard this action as forms of institutionalized corruption and self-interest that hinders the provision of accessible health services.
The contentious agreement was signed in July last year after the clinical officers went on strike for 99 days. For Prime Edition, I'm Abdulaziz Abeid.